Hi, I am Dr. Ameen. I am a consultant neurosurgeon at Union Hospitals, Vijayawada. Today, let us talk about spinal problems and their treatment options. Spine in the human body is divided into four parts: the cervical part, which is the neck; back, which is the dorsal spine; lumbar spine, which is the lower back; and the sacral spine, which is the which is lower to that. So, commonest problems are seen in the cervical spine and the lumbar spine. The commonest problem we see is disc problem, which is compressing the nerve root. Disc is nothing but a soft material which is seen between the vertebral bodies, which goes and compresses the nerve roots which are lying just adjacent to it. So what happens is, whenever this disc compresses, the nerve which is getting compressed starts radiating the pain to the affected area, with causing severe numbness of the hand and weakness of the hand. And if it is not treated in time, the patient will suffer with pain, and the weakness might become permanent. So for that, we have options like initially we can manage those things with medicines, but later on, if the thing goes severe, then we have to go for a surgery and remove that disc, free the nerve root, and sometimes do a fixation also. So the cervical spine, you usually operate for mostly two reasons. One is the degenerative cervical spine, which is in the form of a cervical disc, or compression of the cervical cord. I mean the nerves in the cervical spine, which is usually because of the age-related problems. The surgery can be done from the front and from the back as well. In the lumbar spine, there are various reasons why we operate. In the lumbar spine, the commonest problem is the sciatica, which we see very commonly, which can be dealt with medicines initially, but if the patient becomes more symptomatic and the weakness becomes severe, then surgery is the only option left. And the surgery also we can do in many ways. Today we have a lot of technologies ready. We can do it in an open way, we can do it in a microscopic way with a smaller incision, and we can do it in an endoscopic way in an even smaller incision, removing the pathology completely. And the other reasons why we can operate for a spine is due to trauma. The patient will have fractures of the spine, because of which there will be instability of the spine. For that, the patient will require surgery in the form of fixation and fusion of the spine. The lumbar spine, there will be usually we see degenerative changes in the lumbar spine in elderly people. Those are in the form of listhesis, that is slipping of the vertebral bodies over one over the other, further causing compression of the nerves, which is again relieved by surgery. That again requires a decompression of the nerve, and again the fixation is necessary at that point. So treatment of the spinal problems can be dealt with best if we can treat them early. If the patient is present to us in an early stage, and the treatment can be good, and we can give a permanent relief for the patient. So I urge everybody to approach the doctors for their appropriate treatment for their problems in the early stage, so that their problems can be solved in a complete way. Thank you.